I am Dr. Cassius Camden Clay. I am here to teach you how to muscle test exactly where chronically weak muscles are located in most adults. I'm also here to teach you how to confirm that these weak muscles have become instantly strong through the use of my quick cell fixes. Here's some muscle testing history. In 1949, Kendall and Kendall set the standard for medical muscle testing in their book entitled Muscles, Testing and Function. In 1964, George Goodhart, chiropractor, began developing applied kinesiology. Applied kinesiology took muscle testing to a whole new level, and it included a complicated system for making weak muscles strong. Traditional muscle testing misses much more muscle weakness than it finds. Traditional muscle testing does not really test the whole muscle as it indicates. My research proves that in many medium and large muscles, commonly the entire muscle is not weak, yet isolated sections within a muscle are weak. For instance, the belly or center of muscles are commonly weak, while the origins and insertions where the muscles start and end are commonly strong. About 17 years ago, I discovered subtle muscle testing. Subtle muscle testing is a way of lightly touching the skin over muscles to quickly discover subtle variations in muscle tone, thereby distinguishing between weak and strong parts of muscles. To the touch, weak muscles feel mushy and strong muscles feel firm. Through subtle muscle testing, I've pinpointed 33 muscle tests which are almost always weak on one or both sides of the body in most adults. 24 of these 33 muscle tests do not exist in traditional muscle testing literature. Through necessity, I have developed these 24 muscle tests to specifically target chronically weak muscles or sections of muscles discovered through subtle muscle testing. Why do we muscle test? We muscle test to locate weak muscles and prove that quick cell fixes have made these weak muscles instantly strong. Without muscle testing as validation of increased strength, people are less motivated to do their quick cell fixes daily. For instance, this is my shoulder, arm, wrist quick cell fix-it routine. This is the biceps tendon fix for the biceps brachii long head. This is the elbow punch for the supinator muscle and finger extensors. This is the wrist fix for the opponent's muscles. This is the shoulder fix for the teres minor, subscapularis, infraspinatus, and supraspinatus. This is the clavicle fix for the coracobrachialis, and this is the cranial fix for the anterior deltoid, middle deltoid, upper trapezius, and subclavus. Quickly, it looks like this. Who would believe that all of these important muscles would be chronically weak on most adults in the same places, and who would believe that doing this silly-looking breakdance routine would make all of these important weak muscles strong? Not me. I would only believe it with repeatable proof. This is why I package quick cell fixes and muscle testing together. Repeatable muscle testing proves that quick cell fixes make and keep previously chronically weak muscles strong. This is a new profession. Muscle testing is a fun way to educate family and friends and clients about quick cell fixes and their benefits. We call it amazing muscle testing fun. I am bringing muscle testing to the mainstream by teaching muscle testing exactly where many muscles are chronically found weak. Your success at finding weak muscles and helping make them instantly strong with quick cell fixes will be phenomenal, and your interest in learning this science and art will remain piqued. I have created an easy-to-learn muscle testing course for professionals and lay people alike. If you work in a related healthcare field, you may choose to integrate quick cell fixes and muscle testing into your profession. Or if you are not in a related healthcare field, you may choose to get a personal trainer certification that may enable you to work for pay doing muscle testing and quick cell fixes. Please check the laws in your state or country governing the scope of personal trainers. I recommend that you study and become competent doing quick cell fixes on yourself prior to learning these muscle tests or teaching quick cell fixes. Every worthy skill takes a lot of practice. Remember, learning quick cell fixes and muscle testing from a DVD and book is like learning yoga from a DVD and book. It does not replace a live teacher. We invite you to attend Quick Self Fixes and muscle testing workshops for better competency. Come to us or bring us to you. Contact us at www.quickselffixes.com or call 404-808-4280. Let's get started. First, muscle testing people where they are injured can make them worse, so don't do that. Second, pain during a muscle test makes a muscle test invalid. People will generally not hold strong even if they could when the muscle test causes pain. Also, pain indicates potential harm, so don't do that either. And third, you must be gentle. It is very easy to overpower a strong muscle and make it appear weak by using too much force and/or speed. Muscles have several reflex systems which abruptly make strong muscles go weak to prevent injury when the muscle is being physically overstressed. You want to gauge the power differential between you and the person being tested, meet them at their level of strength, and then increase your challenge incrementally to gently challenge their muscle strength. We are gathering information. This is not a power struggle to see who can win. We are evaluating their degree of specific muscle strengths and weaknesses as objectively as we can. Have a friend or friends who are studying muscle testing with you validate your muscle testing findings. They should find exactly the same muscle weakness that you have discovered and later confirm that weak muscles have become strong through the use of Quick Self Fixes. There are 3 levels of muscle strength that we challenge. The first level is initial strength. If the muscle does not have initial strength, it immediately goes weak, and if a muscle tester is too forceful, it may even hurt. This is why the first test must be a very gentle trial test to confirm that the muscle has the initial strength to safely withstand a core strength muscle test. The second level of strength is core strength. If core strength is present, the muscle tests strong. If core strength is not present, the muscle may initially appear strong and then suddenly go weak during the first 2 seconds. The third level of strength is sustained strength. When core strength is present, the muscle appears strong. This third test challenges the muscle for a couple of seconds longer, testing the muscle's endurance for no more than 4 seconds. When the muscle passes the sustained strength test, it is confirmed strong beyond a reasonable doubt. To start your initial muscle strength test, first explain the muscle test so the person you are testing will know exactly what to do during the test. For example, which way you are going to push or pull, which way they will resist the push or pull, where and how you're going to brace them so they don't lose their balance or move inappropriately during the muscle test. Just prior to actually doing the test, say, hold strong. Give them a second or less to respond. When you feel their muscle engage, immediately match your pressure to their strength and only then gently increase your pressure. If the muscle being tested is unable to meet your mild pressure and falls weak, that means the muscle does not have initial strength. It is very weak and the test is over. Remember, I am teaching you how to test muscles where they are chronically found weak. Be careful and be gentle. If this muscle does meet your mild pressure and thus has initial strength, you are then free to test the muscle for core strength. Repeat the exact same test, incrementally increasing pressure for no more than 2 seconds. If the muscle goes weak during these 2 seconds, well then, it's weak. If the muscle tests strong, it has core strength. Do one more similar test using a little more pressure for up to 4 seconds. This tests sustained strength. If the muscle remains strong, this confirms beyond a shadow of doubt that this muscle is indeed strong and has endurance. Do not get confused. We will review these concepts over and over during our muscle testing demonstrations. Sometimes, even though a previously weak muscle now tests strong, areas may continue to be painful. The body needs time to clear away inflammation and heal. I much prefer a patient leave my office and say, "Hey doc, it still hurts," rather than, "Hey doc, it's still weak." When the patient's muscles are made strong and hold strong, the odds are high that they will get well. Sometimes the biggest issue in learning muscle testing and teaching Quick Self Fixes is finding people to practice on. Be brave. Ask people for help. They will volunteer. They will help you. Remember, this is amazing muscle testing fun. Learn all of the Quick Self Fixes before learning muscle testing. Muscle testing confirms that quick cell fixes have made previously weak muscles strong. This muscle testing course includes a brief review of quick cell fixes. However, this review does not take the place of the comprehensive quick cell fixes course. Also, study the muscle testing book and learn these muscles, where they are, and what they look like. Do not muscle test where there is injury and/or pain. And remember, it is easy to overpower a strong muscle and make it appear weak, so be gentle. Most muscle tests in this series are easy to very easy to learn competently. When I say hold strong, I wait for Christy's muscle to engage before I meet her pressure and strength. Hold strong. Good. Furthermore, once her muscle has engaged, if I go suddenly, quickly, and with force, hold strong, the muscle goes weak, it has been overpowered. This is the art. Take some practice. Hold strong. Good. Now, there are 3 levels of strength that we challenge with each muscle test. The first level of strength is initial strength. Is the muscle functioning? Hold strong. When there is not initial strength, the muscle just goes weak with very little challenge. The muscle test is now over. The second level of muscle strength that we challenge is core strength, which is challenged by meeting Christy's strength and adding just a little more pressure for 2 seconds. Hold strong. 1, 2. Christy has her core strength. The third level of strength that we challenge is sustained strength. For the count of 4. Hold strong. 1, 2, 3, 4. Rarely is sustained strength weak when core strength is present. Sustained strength proves beyond a shadow of a doubt that the muscle is indeed strong. After each muscle test, pause the video and test the same muscle on the other side of the body. This is the test for the biceps brachii long head. That muscle is right here. Christy, keep your arm parallel to the floor. When I'm testing, I'm not pushing down on her hand. That would be an invalid test. I'm pushing down on her wrist. I'm going to brace Christy right here on her shoulder. If I don't brace there, if I just push down, say hold strong, push down, Christy's going to fall forward. So I'm bracing, arms parallel to the floor. I'm going to test initial strength. Hold strong. Christy has initial strength. I'm going to test core strength. Hold strong. Christy has core strength. And now hold strong again for sustained strength. Hold strong. 1, 2, 3, 4. Christy has sustained strength. Were that muscle weak, Christy would do the bicipital tendon fix to make biceps brachii long head strong. And that fix is done. Christy knows this one. Go on and do it for us, Christy. Thank you. Arm parallel to the floor. Hold strong, initial strength. Hold strong again, core strength, 1, 2. Hold strong again, sustained strength, 1, 2, 3, 4. These are the tests for the supinator muscle, right here, and the finger extensor muscles right here. These muscles commonly go weak together and become strong together using the elbow punch fix and or the elbow torque fix. First we have the muscle test for the supinator. Christy, make a fist. This is Christy's right hand. I'm taking my left hand and going underneath her right hand, gripping the little finger side of her right hand just like that. Now, I'm taking my right hand and I'm going over her right hand, gripping the thumb side of her hand just like that. It's going to look just like this. I'm going to be turning her palm. The palm goes palm down. That's how the test is going to look. So turn back this way. And now, hold strong, but don't hold strong. So there we go. That would be not having initial strength. This time, do hold strong. Hold strong, initial strength. hold strong core strength, and hold strong sustained strength. 1, 2, 3, 4. This is the test for the finger extensor muscles. Christy's going to have her arm parallel to the floor with her fingers all the way up. I am going to pressure her fingers with one finger. I'm going to use my middle finger placed right there, not on her hand, but just where her fingers meet her hand, right there. And I'm going to say, hold strong and pull your fingers toward me, but you don't hold strong this time. Hold strong, that would be no initial strength. Now, this time hold strong, there's initial strength, hold strong again. There's core strength, hold strong again. There's sustained strength. When the supinator muscle is weak, you can beat it. When the supinator muscle is strong, you can't beat it. It's a super strong muscle. With the finger extensors, even when they're strong, they're not that strong. That's why we only use one finger right there to make it a fair test. The elbow punch fix and the elbow torque fix instantly makes supinator and finger extensors strong. And now we will demonstrate the elbow punch fix. Ready, Christy, for the elbow punch fix? Pow. Christy, make a fist. This is Christy's right hand. I'm taking my left hand and going underneath her right hand, gripping the little finger side of her right hand just like that. Now, I'm taking my right hand and I'm going over her right hand, gripping the thumb side of her hand just like that. It's going to look just like this. I'm going to be turning her palm. The palm goes palm down. That's how the test is going to look. So turn back this way. And now hold strong, but don't hold strong. So there we go. That would be not having initial strength. This time, do hold strong. Hold strong, initial strength. Hold strong, core strength. And hold strong, sustained strength. 1, 2, 3, 4. Christy's going to have her arm parallel to the floor with her fingers all the way up. I am going to pressure her fingers with one finger. I'm going to use my middle finger placed right there, not on her hand, but just where her fingers meet her hand, right there. And I'm going to say, hold strong and pull your fingers toward me, but you don't hold strong this time. Hold strong, that would be no initial strength. Now, this time hold strong. There's initial strength, hold strong again. There's core strength, hold strong again. There's sustained strength. This is the muscle test for the opponent's muscles. The opponent's muscles are right here and right here. Christy, bring your little finger and your thumb together. Pause, please. Not your index finger and your thumb. This is your little finger and your thumb. Make it nice and round, like an apple, not like a pear. I'm going to test this using my little fingers. And don't hold strong this time. Hold strong, initial strength not present. And hold strong again, this time hold strong, initial strength present. Hold strong again, core strength present, and hold strong again. 1, 2, 3, 4, sustained strength is present. I can beat that test. Those are little muscles. I can overpower those. Be careful to match their strength and then up it just a little bit. This is not a power struggle to see who can win. This is gathering information as objectively as we can. The quick self-fixes for weak opponent muscles begins with the wrist fix. Place your thumb right in your carpal tunnel arch, grasp your wrist, and for the count of 2, rigorously shake. 1, 2. That's your wrist fix that commonly makes the weak opponent's muscles strong. The occiput glide fix also makes the opponent's muscles instantly strong. Once again, the test. Christy, arm parallel to the floor, Make an apple using my little fingers. Hold strong initial strength, hold strong core strength, and hold strong sustained strength. 1, 2, 3, 4. These are the tests for infraspinatus and supraspinatus. First is infraspinatus. Christy's arm is parallel to the floor. Her forearm is perpendicular to the floor. I'm holding her elbow firmly as I attempt to push her forearm straight down, just like that. Turn this way, Christy. Thank you. It's going down just like that. Christy, hold strong, but don't hold strong. If it was weak, it would go weak just like that, not having initial strength. Turn back this way and hold strong, initial strength. Hold strong, 1, 2, core strength. Hold strong again, 1, 2, 3, 4, sustained strength. Now for the supraspinatus test. I'm not pushing on her hand, I'm pushing just above her wrist, pushing her hand towards her hip. My hand here stabilizes her opposite hip. I'm pushing her arm towards her body and hold strong. When it goes weak, it just goes weak. And now hold strong again, initial strength is present. Hold strong again, core strength is present. Hold strong again, sustained strength is present. This hand goes with this shoulder, this hand goes with this elbow. You're going to push straight up. You're not pulling out, you're pushing straight up toward the sky, and then once you're at maximum tension, there's a very gentle set. So turn to your side this way and do the shoulder fix for us, Christy. Good, thank you. Here is the test for infraspinatus. Arm is at right angle, just like this. I'm bracing the elbow. I'm not pushing on the hand. I'm pushing on the wrist. I'm going to push this way, Christy, and go weak, please. Hold strong. No initial strength. This time, Christy, hold strong. Initial strength. Hold strong again. Core strength. Hold strong again. Sustained strength. 1, 2, 3, 4. Let's test it again from this angle right here. And with the first test, let it go weak. And hold strong. That would be your test if it was weak. Initial strength, hold strong. Core strength, hold strong. 1, 2. Hold strong again for sustained strength. 1, 2, 3, 4. Good. Retest this muscle, supraspinatus, that your arm inches just a little bit. Hold strong. I'm going to push this hand towards your body. Initial strength, and hold strong. Core strength, 1, 2, and hold strong. Sustained strength, 1, 2, 3, 4. Great. These are the tests for the bellies of anterior deltoid medial division, anterior deltoid lateral division, middle deltoid anterior division, and middle deltoid posterior division. Turn this way, please, Christy. When testing the bellies of these muscles, we must always test above parallel to floor by 5 degrees or so. That shortens the muscle and focuses the test on the belly of the muscle. With the first test for anterior deltoid medial division right here, Christy's arm must cross her midline. There's her midline, and that hand is definitely crossing the midline. I'm pushing on the wrist, I'm stabilizing this shoulder, and let the arm go weak, Christy. Hold strong. There's your test. All right, initial strength, hold strong. Core strength, hold strong. And sustained strength, hold strong. Good. Rest for a second. And now we're going to test anterior deltoid lateral division. The arm is just about straight out in front of the body, up 5 degrees from being parallel to the floor. And let the arm go weak, Christy. Hold strong. There's your weak test. Now, initial strength, hold strong, core strength, and hold strong, sustained strength. 1, 2, 3, 4, rest. Now for the test for middle deltoid anterior division. We've tested the anterior deltoid medial division, anterior deltoid lateral division, and this one is further to the side, going obliquely from the body for the middle deltoid anterior division. And let your arm go weak, hold strong, there's weak, and now hold strong, initial strength, hold strong, core strength, and hold strong, sustained strength. 1, 2, 3, 4, and rest. For the middle deltoid posterior division, the arm comes straight out to the side, there's parallel, here's a little above parallel. Let it go weak, Christy, hold strong, there's your weak test. Now, hold strong, initial strength, and hold strong, core strength, and hold strong, sustained strength. The previous 4 deltoid muscle tests and the following upper trapezius muscle test are all fixed together with the upcoming cranial fix. Here is a test for upper trapezius scapular division medial zone. That muscle section is right here. Now, Christy's arm is straight and it's at this angle, her palm is facing down. I'm contacting not on her hand, just above her wrist. Most importantly with this test, her whole arm crosses her midline. So, when this muscle goes weak, hold strong, just drops down just like that. And hold strong, testing initial strength, and hold strong again, testing core strength, and hold strong again, testing sustained strength. 1, 2, 3, 4. The cranial fix makes the deltoid and upper trapezius muscles instantly strong. CT strap procedure C, the occiput glide fix, and the guided neck stretch fixes also make the deltoid and upper trapezius muscles instantly strong. Christy's arm is straight and it's at this angle, her palm is facing down. I'm contacting not on her hand, just above her wrist. Most importantly with this test, her whole arm crosses her midline. When this muscle goes weak, hold strong, just drops down just like that. And hold strong, testing initial strength, and hold strong again, testing core strength, and hold strong again, testing sustained strength. 1, 2, 3, 4. With the first test for anterior deltoid medial division right here, Christy's arm must cross her midline. There's her midline, and that hand is definitely crossing the midline. I'm pushing on the wrist, I'm stabilizing this shoulder, and let the arm go weak, Christy, hold strong, there's your test. Alright, initial strength, hold strong, core strength, hold strong, and sustained strength, hold strong. Rest for a second. And now we're going to test anterior deltoid lateral division. The arm is just about straight out in front of the body, up 5 degrees from being parallel to the floor. And let the arm go weak, Christy, hold strong. There's your weak test. Now hold strong, initial strength, hold strong, core strength, and hold strong, sustained strength. 1, 2, 3, 4, rest. Now for the test for middle deltoid anterior division, and let your arm go weak, hold strong, there's weak, and now hold strong, initial strength, hold strong, core strength, and hold strong, sustained strength. 1, 2, 3, 4, and rest. For the middle deltoid posterior division. The arm comes straight out to the side. There's parallel. Here's a little above parallel. Let it go weak, Christy. Hold strong. There's your weak test. Now, hold strong, initial strength, and hold strong, core strength, and hold strong, sustained strength. Following are 3 middle trapezius muscle tests. This is the muscle test for the belly of the middle division of middle trapezius. The middle trapezius muscle belly is right here, certainly on both sides. I test both of these muscles at the same time. I bring Christy's arms parallel to the floor with her hands facing in. I bring her arms out obliquely and then about 5 degrees more. Her arms aren't all the way out to the side. They aren't all the way in front. They're obliquely out and then 5 degrees more. Sometimes they both go weak. Commonly both muscles go weak at the same time. Sometimes only one goes weak. This time both go weak. Hold strong, Christy. That would be weak, and now just let this one go weak. Hold strong, Christy. There you go. So now hold strong for initial strength, and hold strong for core strength, and hold strong for sustained strength. This muscle is tested with the belly of the superior division of middle trapezius and also with the belly of the inferior division of middle trapezius. The superior division test is very similar, only I bring your arms up higher. Just here, I go out obliquely and 5 degrees more. Hold strong but go weak. And then hold strong but go weak on one side. And now you're going to hold strong initial strength, hold strong core strength, and hold strong sustained strength. And now for testing the belly of the inferior division of middle trapezius. Here was the middle division. Here's the inferior division right there. And bring your arms out obliquely and 5 degrees more. And let your arms go weak. That would be weak. And now on one side, hold strong. And now I'm going to test initial strength, hold strong. And core strength, hold strong. And sustained strength, hold strong. 1, 2, 3, 4. Here are 2 pectoralis major muscle tests. Now we test the superior division of pectoralis major. It's right here, focusing on the belly. Christy's arm is parallel to the floor. Her hand is facing out. It's very important that her arm crosses her midline to get to the belly of that muscle. I'm bracing on this side and hold strong. I'm going to push out. That would be weak. And now hold strong. Initial strength, hold strong. Core strength, hold strong. 1, 2, 3, 4. Sustained strength. This is the test for the belly of the inferior division of pectoralis major. The superior division is here, the middle division is here, and the inferior division is here. Remember, with the superior division, I'm pushing with her arm parallel to the floor going that way. With the inferior division, I'm bringing her arm down, obliquely down, and now I'm going to be pushing straight up. And hold strong, and that would be the weak test there. And now hold strong again, initial strength, hold strong again, core strength, hold strong again, sustained strength. 1, 2, 3, 4. I'm pushing by lifting my legs up versus pushing my arm up. It's better ergonomics. This is the muscle test for pectoralis minor belly. Pectoralis minor is right here underneath pectoralis major. Christy, keep your arm parallel to the floor with your elbow locked straight with your palm facing me, thumb pointing toward the ceiling. I'm contacting not on Christy's hand, I'm contacting on her distal forearm, and I'm bracing the opposite shoulder for stability. I'm crossing Christy's midline with her arm to shorten to test the belly of pectoralis minor. Christy, I'm pushing that way. You hold this way, keeping your arm across your midline. Hold strong, initial strength, hold strong again, core strength, hold strong again, sustained strength. I'm pushing by lunging. I'm not pushing by taking my arm and pushing like that, like that. I'm pushing by lunging, which is better ergonomics for me. The quick self-fix is the clavicle fix. Good. Here's the retest for pectoralis minor belly. Arms parallel to the floor, elbows locked, palms facing me, thumbs pointing toward the ceiling. I'm holding her distal forearm, bracing her opposite shoulder. Her arm crosses the midline to test the belly of pectoralis minor. I'm going to push that way. You push this way. Hold strong. Initial strength. Hold strong again. Core strength. Hold strong again. Sustained strength. I bring Christy's arms parallel to the floor with her hands facing in. I bring her arms out obliquely and then about 5 degrees more. Her arms aren't all the way out to the side. They aren't all the way in front. They're obliquely out and then 5 degrees more. Sometimes they both go weak. Commonly both muscles go weak at the same time. Sometimes only one goes weak. This time both go weak. Hold strong, Christy. That would be weak, and now just let this one go weak. Hold strong, Christy. There you go. So now, hold strong for initial strength, and hold strong for core strength, and hold strong for sustained strength. The superior vision test is very similar, only I bring your arms up higher. Just here, I go out obliquely and 5 degrees more. Hold strong, but go weak. And then hold strong, but go weak on one side. And now you're going to hold strong initial strength, hold strong core strength, and hold strong sustained strength. And now for testing the belly of the inferior division of middle trapezius. Here was the middle division. Here's the inferior division right there. And bring your arms out obliquely and 5 degrees more. And let your arms go weak. That would be weak. And now on one side, hold strong. And now I'm going to test initial strength, hold strong. And core strength, hold strong. And sustained strength, hold strong. 1, 2, 3, 4. And now hold strong. Initial strength, hold strong. Core strength, hold strong. 1, 2, 3, 4. Sustained strength. With the inferior division, I'm bringing her arm down, obliquely down, and now I'm going to be pushing straight up. And hold strong, and that would be the weak test there. And now hold strong again, initial strength, hold strong again, core strength, hold strong again, sustained strength. Hold for 4 seconds. This is the muscle test for the medial division of the lower trapezius. That section of muscle is right here. Chrissy's arm goes straight up with her palm facing me. I brace the same side of her chest with the back side of my hand, and I'm going to pull straight towards me. Your elbow remains locked, Christy. I'm not contacting your hand, I'm contacting just near your wrist. And hold strong, that would be the weak test. And hold strong, initial test. And hold strong again, core strength. And hold strong again, sustained strength. Now we have the muscle tests for the bellies of the latissimus dorsi sections. First we start with the belly of the middle latissimus dorsi muscle right in here. Christy's palm is facing behind her. Her hand is about 20 degrees from her hip. I'm holding just at her wrist and I'm bracing the back of my hand on her hip, and I'm pulling towards myself. And hold strong, that's how the weak test looks. Hold strong again, initial strength. Hold strong again, core strength. Hold strong again, sustained strength. Now I'm going to test the belly of the superior division of latissimus dorsi. And that's going to be right in this area right here. So, I am going to pull obliquely away from Christy. I'm not standing in front of her. I'm not standing any longer to the side. I'm standing obliquely. Her arm is straight. The thumb is pointing in towards your body. I'm going to hold right here, not on your hand, but just above your wrist. I'm going to brace your hip with the back side of my hand and pull straight towards me obliquely. Hold strong. That would be your weak test. And hold strong, initial strength. Hold strong, core strength. Hold strong, sustained strength. 1, 2, 3, 4. Now I test the belly of the inferior division of latissimus dorsi. This time I'm not standing behind Christy. I'm not standing to the side of Christy. I'm standing oblique. And I'm again bracing her hip with the back side of my hand. Her hand's about 20 degrees from her body. Again, her palm is facing back with her thumb closest to her body. And I'm pulling towards me. Hold strong. That would be a weak test. Now hold strong, initial strength. Hold strong, core strength. And hold strong, sustained strength. These tests are made strong with the latissimus dorsi fix. The latissimus dorsi fix also makes the lower trapezius medial division instantly strong, which is a reflex point or two underneath the breast and between the ribs. You go between the ribs, underneath the breast, on the nipple line, searching for tender spots. When you find it, work it certainly within a threshold of comfort. These points can be painful. Be kind to yourself. Miraculously, working these points on both sides make all of these muscles instantly test strong. The latissimus dorsi muscles are also made strong with connective tissue strap procedures A, B, and D. Christy's arm goes straight up with her palm facing me. I brace the same side of her chest with the back side of my hand, and I'm going to pull straight towards me. Your elbow remains locked, Christy. I'm not contacting your hand. I'm contacting just near your wrist. And hold strong. That would be the weak test. And hold strong, initial test. And hold strong again. Core strength. And hold strong again. Sustained strength. I'm holding just at her wrist, and I'm bracing the back of my hand on her hip, and I'm pulling towards myself. And hold strong. That's how the weak test looks. Hold strong again, initial strength. Hold strong again, core strength. Hold strong again, sustained strength. I'm not standing in front of her. I'm not standing any longer to the side. I'm standing obliquely. Her arm is straight. The thumb is pointing in towards your body. I'm going to hold right here, not on your hand, but just above your wrist. I'm going to brace your hip with the back side of my hand and pull straight towards me obliquely. Hold strong. That would be your weak test. And hold strong, initial strength. Hold strong, core strength. Hold strong, sustained strength. 1, 2, 3, 4. Now I test the belly of the inferior division of latissimus dorsi. This time I'm not standing behind Christy. I'm not standing to the side of Christy. I'm standing oblique. And I'm again bracing her hip with the back side of my hand. Her hand's about 20 degrees from her body. Again, her palm is facing back with her thumb closest to her body. and I'm pulling towards me, hold strong. That would be a weak test. Now hold strong initial strength, hold strong core strength, and hold strong sustained strength. This is the test for the belly of the piriformis muscle. This muscle runs deep to gluteus maximus and gluteus medius right here. First, the lower leg is perpendicular to the floor, straight up. The thigh is pulled apart and away from the other thigh. This lower leg crosses just above the knee right there. I'm holding the ankle. I'm bracing Christy's inner thigh right there, and I'm pulling this leg towards me. Christy, go weak the first test, okay? Hold strong. That's your test right there. And this time hold strong, Christy. Initial strength, and now hold strong again. Core strength, and now hold strong again. Sustained strength, 1, 2, 3, 4. The piriformis fix makes the piriformis muscle instantly strong. The sacroiliac ligament fix also makes the piriformis muscle instantly strong. Here is the test for the belly of the piriformis muscle. The lower leg is perpendicular to the thigh. The legs are significantly apart. This lower leg crosses Christy's lower thigh just above her knee. I'm holding her ankle. I'm bracing her inner thigh on the opposite side. And hold strong, Christy, and this would be the test right there if it was weak. Now, I'm going to pull and you're going to stop me. Hold strong, initial strength, and hold strong again, core strength, and now hold super strong. 1, 2, 3, 4, sustained strength. This is a muscle test for the transverse abdominis, belly of the lower division. On the left-hand side, this muscle contracts like this, and on the right-hand side, this muscle contracts like this. Both sides run transversely, although they do not cross the midline. Christy, have your foot touch just above your kneecap on your distal quadriceps. This knee is going to cross your midline by up to 45 degrees. Your pelvis is coming up off the table a bit. Your shoulders are staying in contact with the table. I'm using my flat palm to brace Christy's inner thigh in the very middle. I'm pulling Christy's leg this way. Christy, you're going to hold your leg that way, all right? I'm bracing my knees on the table, and I'm pulling by leaning backwards, not by pulling my arm like this. It's better ergonomics. Hold strong, initial strength. Hold strong, core strength. Hold strong, sustained strength. 1, 2, 3, 4. The quick self-fix for transverse lower abdominis is the transverse abdominis fix. Connective tissue strap procedure A and D also make the transverse abdominis muscle instantly strong. This is the retest for transverse abdominis, belly of the lower division. Christy, have your foot touch just above your kneecap on your distal quadriceps. Your knee is going to cross your midline by up to 45 degrees. I'm using the flat of my palm, bracing on Christy's inner thigh in the very middle. I'm bracing the table with my knees. I'm pulling your knee this way. You're holding your knee that way. Ready? Hold strong, initial strength. I'm pulling by leaning backwards. Hold strong again, core strength. Hold strong again, sustained strength. I'm not pulling by doing like that. I'm pulling by leaning backwards. It's better ergonomics for me. This is the test for the belly of the posterior division of gluteus medius. It's right here, partially underneath gluteus maximus. Christy, lay face up, please. Bring the leg way out to the side. That shortens gluteus medius posterior, focusing the test on the belly. If you start your test right here, pulling this way, it commonly tests strong. If you go further out, way out there, you concentrate your test on the belly of the muscle where it is commonly found weak. Christy, have your foot turned all the way out. That's very important, having the foot turned out. The foot's turned up, it's testing gluteus medius middle division. So the foot's got to be turned all the way out. I'm going to hold your ankle. I'm going to pull this foot toward this foot, dragging it across the table. First time, go weak and hold strong, and that's your test right there. So, Christy, hold strong for initial strength. Good. Hold strong for core strength. Good. And now hold strong for sustained strength. There are two quick self-fixes for a weak belly of the posterior division of gluteus medius. The first fix is foot fix. Can you show us that fix, please, Christy? Good. And now, show us the iliotibial band fix, please. Thank you, Christy. The connective tissue strap procedures A and D also make gluteus medius instantly strong. Hold strong for initial strength. Good. Hold strong for core strength. Good. And now hold strong for sustained strength. I'm now teaching 3 muscles which cross the hip and commonly go weak together and strengthen with each other with 2 of our quick self-fixes. These muscles are rectus femoris, psoas, which runs deep along the side of the spine, and the posterior belly of tensor fascia lata. Christy, lay face up, please. The first test is for rectus femoris, straight head, belly. This would be 90 degrees, this would be 45, and this would be 0. We're bringing this leg up to about 70 degrees for the test. You're going to hold this leg strong here, please, Christy. I'm bracing on the opposite hip bone right there. I'm holding the ankle. If it was weak, I don't want the leg to just crash to the floor, and I want to hold it. This time go weak, okay? And hold strong. That would be weak. Now, this time hold strong. There's your initial strength. Hold strong again, core strength, and hold strong again, sustained strength. If you start your leg with the test at 45 degrees, commonly it's going to test strong there. You bring the leg up to 70, which focuses on the belly of the straight head of rectus femoris, and it's going to test weak here. The next test is the belly of psoas major. It's going to be right about there in the belly of this muscle. Again, here's 0, there's 45, there's 90 degrees. I'm going to go to about 70 degrees. I'm going to turn the foot out, and I'm going to bring the leg out, not too far. I'm pushing not straight down toward the table. I'm not pulling out towards me. I'm going obliquely and down. I'm going to brace on this hip. This time you let it go weak, Christy. Hold strong here. That would be your weak test right there. This time hold strong, please. Initial strength. Hold strong, core strength, and hold strong, sustained strength. 1, 2, 3, 4. The third test is for the belly of tensor fascia lata posterior. The leg comes up. This would be 45 degrees. I'm going to come way out here. I'm going to turn that foot way in and pull this foot towards that foot. Hold strong right there. That would be weak. And now hold strong, initial strength. Hold strong for the count of 2, core strength. Hold strong, sustained strength. 1, 2, 3, 4. If you start your test in closer, it's probably going to test strong. You have to isolate the belly of the muscle by bringing this leg super far out. The 2 quick self-fixes for these 3 weak muscles are the hip fix and the ankle fix. Christy, could you please show us the hip fix and then the ankle fix? There's the hip fix. And here's the ankle fix. Thank you, Christy. Here's a review of the belly of rectus femoris straight head, the belly of psoas major, and the belly of tensor fasciae lata posterior. First is the rectus femoris. That's 0 degrees, that's 90 degrees, this is 70 degrees. I'm bracing this hip bone right here. I'm holding the ankle where the leg doesn't crash down. Let it go weak, Christy, hold strong, and the leg would drop down. You're holding it so it doesn't drop. So, knee straight, leg straight, foot straight, hold strong, initial strength, hold strong, core strength, hold strong, 1, 2, 3, 4, sustained strength. And now for psoas major, belly. The leg comes up to 70 degrees again, the foot turns out all the way out, the leg comes out obliquely from the torso. Again, I'm holding the ankle, so if it does go weak, the leg doesn't just crash to the floor. And let this go weak, Christy, hold strong, that would be weak. Again, if you're testing with the leg further down than 70 degrees, it's probably going to test strong. When you bring that leg up, you are isolating and testing the belly of psoas major, which is commonly weak on most people on one or both sides. Leg straight, foot's turned out, and hold strong, initial strength, hold strong, core strength, and hold strong, 1, 2, 3, 4, sustained strength. Thank you, Christy. And last is tensor fasciae lata. I'm bringing the leg up to 45 degrees. I'm bringing the leg way out to oblique from the body. The foot turns all the way in. I'm going to push this foot toward that foot, and you hold strong, let it go weak. There's your test. And again, hold strong, initial strength. I'm pushing toward that foot. Hold strong, core strength. I'm pushing again toward that foot. Hold strong, 1, 2, 3, 4, sustained strength. Connective tissue strap procedures A and D also make the psoas major muscle instantly strong. The iliotibial band fix also makes the tensor fasciae lata muscle instantly strong. These are the muscle tests for popliteus, which is behind the knee, and peroneus tertius, which comes down the outer lower leg. These two muscles are commonly weak together, and both become strong with the quick self fixes, the knee fix, and the meniscus fix. First we have the popliteus muscle test. Bring the leg up and turn the foot way in as far as it'll go in. But the test is going to be to externally rotate the lower leg just like this. However, that doesn't work. I must use her foot for a hold here, just like that. I'm going to hold here. I'm going to pull to bring your foot towards me. Christy, hold strong, but let it go weak, hold strong. That would be a weak popliteus right there. Again, hold strong, initial strength. Hold strong again, core strength. And hold super strong for sustained strength, 1, 2, 3, 4. When doing the popliteus test, position yourself at the feet of your client. Bringing this knee up, I'm turning her foot way internal rotation. The actual test is externally rotating the lower leg to test the popliteus muscle. To do that, I must use her foot as a handle. I brace the inner arch of her foot along my lower forearm, and I grasp her heel. I'm going to hold here. Let it go weak, Christy, hold strong. That would be your test. So, the actual test now: hold strong, initial strength, hold strong, core strength, and hold strong, sustained strength. The popliteus muscle is a very strong muscle. Even when it is weak, it still feels as though it is strong, yet you can beat this test. If you can muscle them and beat this test, that means it's weak. following the knee fix and the meniscus fix, this muscle tests rock hard strong and you will not beat it. That's a strong test. Christy, pull your left toes out as far out as you can and up towards your nose as far as you can. Hold super strong, but don't hold strong. Here's your test. It comes all the way down just like that. That would be weak. Again, the foot goes all the way out and all the way up. Here's your test. It comes all the way down just like that. That would be weak. Again, the foot goes all the way out and all the way up. I'm contacting, and hold strong for initial strength, hold strong for core strength, and hold strong for sustained strength. The quick self-fixes for weak popliteus and peroneus tertius muscles are the knee fix and the meniscus fix. Christy, could you please show us the knee fix first? There's 1, 2, 3, gentle set. And good. And now show us the meniscus fix. And 1, 2, 3, kick. Thank you very much. Bringing this knee up, I'm turning her foot way internal rotation. The actual test is externally rotating the lower leg to test the popliteus muscle. To do that, I must use her foot as a handle. I brace the inner arch of her foot along my lower forearm, and I grasp her heel. I'm going to hold here. Let it go weak, Christy. Hold strong. That would be your test. So, the actual test now: hold strong, initial strength, hold strong, core strength, and hold strong, sustained strength. Christy, pull your left toes out as far out as you can and up towards your nose as far as you can. Hold super strong, but don't hold strong. Here's your test. It comes all the way down just like that. That would be weak. Again, the foot goes all the way out and all the way up. I'm contacting, and hold strong for initial strength, hold strong for core strength, and hold strong for sustained strength. For convenience, the quadratus lumborum and multifidus are tested together. This is a muscle test for the belly of the spinal division of quadratus lumborum. The quadratus lumborum muscles are in the low back on either side of the spine. I am now testing the left quadratus lumborum. Christy, hold the table. I bring Christy's legs way out to the side with my hand going underneath her legs near her ankles. To test the belly, I have to bring the legs further out, way far out, as far as they'll go. And now I'm going to brace way high up on her hip bone. If I brace low down on her hip, she can recruit, falsely seeming to make this muscle strong. Have to brace way high up. And now, hold strong, Christy. It's weak. It looks just like that. So hold strong, initial strength. Hold strong, core strength. And hold strong, sustained strength. I'm not testing by pulling my arms this way. I'm testing by leaning my body away, pulling her legs. That's proper ergonomics. This is the muscle test for the multifidus, iliolumbar division, belly of the superficial layer. This muscle segment connects the pelvis to the lumbar spine, right here. Christy, hold the table with both hands. Bring both legs out to 45 degrees. Turn the outside foot all the way out. Now, I'm holding her outside leg. I have reached underneath both legs. I'm bracing at her anterior superior iliac spine. If I brace down at her hip, it's an invalid test. The brace must be high at the top of the hip bone. Christy, I'm going to pull your feet towards me. You keep your legs on the table and resist as I pull towards me. Hold strong initial strength, hold strong core strength, and hold strong sustained strength. 1, 2, 3, 4. Notice that I have my knees here and here bracing on the table to give me better leverage. The connective tissue strap procedures A and D are the preferred quick self-fixes for making quadratus lumborum and multifidus instantly strong. The pelvic fix, the side stretch fix, and the iliotibial band fix also make quadratus lumborum and multifidus instantly strong. And now for the retest. Hold the table. My hand goes under her legs, close to her ankles. Her legs go way, way, way out to the side. If, as I'm pulling, if she lifts her legs up, that's recruiting and makes for an invalid test. I'm dragging her legs across the table. Remember, brace up real high on her hip and hold for initial strength, and hold again for core strength, and hold strong. 1, 2, 3, 4 for sustained strength. This is the retest for the multifidus, iliolumbar division, belly of the superficial layer. Christy's holding the table. Her legs are out to 45 degrees. Outer foot is turned out. I'm holding the ankle of the outer foot. I'm bracing on the ASIS. I'm bracing my knees on the table. And you keep your legs on the table. Do not lift them up. I'm going to be pulling towards me, and you resist by pulling out. Hold strong initial strength. Hold strong core strength. And hold strong sustained strength. Following is a review of all of the muscle tests that we have learned. Our Strong Club checklist is located near the front of your targeted muscle testing book. Christy is here to apply to be a member of our Strong Club. Membership includes having all 62 muscles that we test strong on a regular basis. Membership provides members with a daily reprieve from weakness and a daily experience of having all of the benefits of having full body strength. This motivates us to practice the quick self-fixes daily. The Strong Club checklist is on 2 pages and is located near the front of your targeted muscle testing book. It is going to appear that I am doing 1 muscle test at a time. However, I am actually doing all 3 muscle tests. I am testing initial strength, core strength, and sustained strength. Turn this way, Christy. Bring this arm up and hold strong initial strength, core strength, sustained strength. There. This is a test for biceps brachii, long head division. And hold strong initial strength, core strength, sustained strength. This is the test for supinator. Make a fist, please. Hold strong. 1, 2, 3, 4. This is the test for finger extensors. Fingers up, please. Hold strong. Initial, core, sustained. This is the test for opponents. Little finger to thumb. Hold strong. 1, 2, 3, 4. This is the test for biceps brachii, long head. Hold strong. Initial, core, sustained. Make a fist, please. This is the test for supinator. Hold strong. 1, 2, 3, 4. This is the test for finger extensors. Hold strong. 1, 2, 3, 4. This is the test for opponents. Hold strong. 1, 2, 3, 4. This is the test for infraspinatus. Hold strong, Christy. 1, 2, 3, 4. This is the test for supraspinatus, anterior division. Hold strong, initial, core, sustained. Infraspinatus. Hold strong. 1, 2, 3, 4. Hold strong. This is the test for supraspinatus, anterior division. Hold strong. 1, 2, 3, 4. Turn this way, please. This is the test for anterior deltoid, belly of medial division. Hold strong. 1, 2, 3, 4. This is the test for anterior deltoid, belly of lateral division. Hold strong. 1, 2, 3, 4. This is the test for middle deltoid, belly of anterior division. Hold strong, initial, core, sustained. This is the test for middle deltoid, belly of posterior division. Hold strong, 1, 2, 3, 4. This is the test for anterior deltoid, belly of medial division. Hold strong, 1, 2, 3, 4. This is the test for anterior deltoid, belly of medial division. Hold strong, 1, 2, 3, 4. This is the test for anterior deltoid, belly of lateral division. Hold strong, 1, 2, 3, 4. This is the test for middle deltoid, anterior division. Hold strong, 1, 2, 3, 4. This is the test for middle deltoid, belly of posterior division. Hold strong, 1, 2, 3, 4. This is the test for upper trapezius, scapular division, medial zone. Hold strong, initial, core, sustained. This is the test for upper trapezius, scapular division, medial zone. Hold strong, 1, 2, 3, 4. This is the test for middle trapezius, belly of middle division. Hold strong, 1, 2, 3, 4. This is the test for middle trapezius, belly of superior division. Hold strong, 1, 2, 3, 4. This is the test for middle trapezius, belly of inferior division, and hold strong, 1, 2, 3, 4. This is the test for pectoralis major, belly of superior division. Hold strong, 1, 2, 3, 4. This is a test for pectoralis major, belly of inferior division. Hold strong, 1, 2, 3, 4. This is the test for pectoralis minor, belly. Hold strong, 1, 2, 3, 4. This is the test for pectoralis major, belly of superior division. Hold strong, 1, 2, 3, 4. This is a test for pectoralis major, belly of inferior division. Hold strong, 1, 2, 3, 4. This is the test for pectoralis minor, belly. Hold strong, 1, 2, 3, 4. This is the test for lower trapezius, medial division. Hold strong, 1, 2, 3, 4. This is a test for lower trapezius, medial division. Hold strong, 1, 2, 3, 4. This is the test for latissimus dorsi, belly of middle division. Hold strong, initial strength, core strength, sustained strength. This is the test for latissimus dorsi, belly of superior division. And hold strong, 1, 2, 3, 4. This is the test for latissimus dorsi, belly of inferior division. Hold strong, 1, 2, 3, 4. This is the test for latissimus dorsi, belly of middle division. Hold strong, 1, 2, 3, 4. This is the test for latissimus dorsi, belly of superior division. Hold strong, 1, 2, 3, 4. This is the test for latissimus dorsi, belly of inferior division. Hold strong, 1, 2, 3, 4. This is a test for piriformis belly. Hold strong, initial strength, core strength, sustained strength. This is a test for piriformis belly. Hold strong, 1, 2, 3, 4. Christy, roll over, please. This is a test for transverse abdominis, belly of lower division. Let your knee cross your midline and hold strong, 1, 2, 3, 4. This is a test for transverse abdominis, belly of lower division. Cross the knee over your midline and hold strong. 1, 2, 3, 4. This is a test for gluteus medius, belly of posterior division. And hold strong. 1, 2, 3, 4. This is a test for gluteus medius, belly of posterior division. And hold strong. 1, 2, 3, 4. This is a test for rectus femoris, straight head division. And hold strong. Initial strength, core strength, sustained strength. This is the test for psoas major, belly. Hold strong. 1, 2, 3, 4. This is the test for tensor fasciae lata, belly of posterior division. Pushing this foot toward that foot. Hold strong. 1, 2, 3, 4. This is the test for rectus femoris, straight head division. Hold strong. Initial strength, core strength, sustained strength. This is a test for psoas major, belly. Hold strong. 1, 2, 3, 4. This is the test for tensor fasciae lata, belly of posterior division. Pushing this foot toward that foot. Hold strong. 1, 2, 3, 4. This is the test for popliteus. Turn your foot all the way in and hold strong. 1, 2, 3, 4. This is the test for peroneus tertius. Hold your little toe up and out and hold strong. 1, 2, 3, 4. This is the test for popliteus. Turn that foot all the way in and hold strong. 1, 2, 3, 4. This is the test for peroneus tertius. Hold your little toe out and up and hold strong. 1, 2, 3, 4. This is a test for quadratus lumborum, belly of spinal division. Hold the table, Christy. And hold strong. 2, 3, 4. Foot turned out, please. This is a test for multifidus, iliolumbar division, belly of superficial layer. Hold strong. 1, 2, 3, 4. Good. This is a test for quadratus lumborum, belly of spinal division. Christy, hold strong. Initial strength, core strength, sustained strength. Turn your foot out, please. This is the test for multifidus, iliolumbar division, belly of superficial layer. Hold strong. 1, 2, 3, 4. Congratulations, Christy. You are now a charter member of our Strong Club.
Woohoo!
Following is an extended demonstration of quick self-fixes and targeted muscle testing with Daryl Stafford. This is Daryl Stafford. He is here to experience quick self-fixes and muscle testing. Daryl, please tell us about yourself.
Well, hi, my name is Daryl Stafford, and I have been a competitive bodybuilder for 25 years. I started off as an amateur and worked my way up to a national competitor, and now, after winning the men's nationals in 1993, I am what we would call an IFBB pro bodybuilder. My latest show was about 4 years ago. I won or actually placed in the men's masters, Mr. Olympia.
And you were Mr. Florida, Mr. Southern United States.
Yes, sir. As an amateur, Mr.
Okay.
Florida, Mr. Southern USA, and then Mr. USA before moving on to the IPB.
Okay. Thank you, Daryl, for being here. Thank you very much.
You're welcome.
All right, so here I'm going to muscle test you where people chronically have weak muscles, even large muscle bodybuilders. So, as I test you, if anything was to cause you any pain because of any injuries, do not resist. It's important, first of all, that you take care of yourself, okay?
Yes.
Good. So the first test I'm going to do is for the biceps brachii long head. And you're going to go palm up for me, please. There you go. And you're going to hold your arm up there, and I'm going to pull down gently, hold strong. He has the initial strength, hold strong again. But he doesn't have core strength. I can get that arm down with very little problem. Let your arm rest now. I'm going to test this side. I'm going to turn you to this side, though. And palm up, arm parallel to floor. I'm checking initial strength, and he doesn't even have initial strength on that side. So, coming back around here, when the biceps brachii long head goes weak, it's most commonly caused by a subluxated bicipital tendon, where the tendon goes through the bicipital tendon groove and over the humeral head. It gets hung up in there. If it could hold, it would tear, so it does not hold. The quick fix it for this, Daryl, is you're going to take your thumb and go right over your humeral head and push as hard as you can toward the opposite side, pushing that way. Then you're going to fish flop your hand behind your body and unkink that tendon. So, you can start right here, over the humeral head, push as hard as you can that way, let your hand rest here, and now fish flop that hand behind your body. Good. Now, watch this. You're going to start, wait. You're going to start here and come back like that, but you're going to do it kind of quick.
Okay.
So take this hand here and pin right there, nice and firm. You can touch here with your fingers, touch right there, and now fish flop that hand behind your body. Perfect. And now do that side.
Okay.
You can start with your hand down here. With your thumb, why don't you hold it with your hand right there, because you're having trouble reaching.
Right,
Just pull it
yeah.
this way with your hand. Get your
Oh,
fingers
okay.
right in there and pull this way, nice and firm towards me. Start with your hand way down there, and now fish flop that hand behind your body. You can stop me. You have to bring it all the way around. Good. Let's see if that worked for you now. Let your arms loose. Good. We're going to bring your arm up again, palm up. Keep your arm parallel to the floor, and I'm going to push down. He has his initial strength. I'm going to push harder, hold strong. He has his core strength, and now I'm going to check sustained strength, hold super strong. 1, 2, 3, 4. He's got his power back. That worked for you. If you do that each day, that's going to keep that muscle strong.
Okay.
It's got to be done for you every day, though.
Right.
Go palm up. And I'm checking your initial strength, which before you didn't have it. You do have it. I'm going to check your core strength now. Hold strong. He's got his core strength, and hold strong now. That worked. Awesome. All right. Now, right there. Now, face me this way. Now we're going to check your supinator muscle that makes your forearm supinate, that supination. You're going to go palm up again, make a fist for me, keep your arms straight for me, straight as you can, and now thumb in. I'm going to try and turn your hand this way. You're going to try and stop me, and stand up straight.
Yeah.
And hold strong. I'm going to try and turn it, hold strong. He can't hold that. He's trying though. Look at that face. He tried. Let your arm rest down,
Okay.
and go palm up for me. Palm up. Turn your palm up. That's okay. And now make a fist and hold strong. And he can't hold that one either. When this muscle's strong, it can't be beat. When the supinator goes weak, the finger extensors also go weak. So hold your fingers up just like this. I'm going to use my middle finger and try and push your fingers down. Arms straight, parallel to the floor. Hold strong. I'm going to pull down. He can't hold that, the one finger test. Check this side. Fingers up. I'm going to use my middle finger, and he can't hold that. There are 2 quick fixes for this. I'm going to give you the quick version, all right? So it's a martial arts punch where you palm up and you punch like that. And pow. Perfect. That relieves a fixation in the elbow joint. And now do that side. Pow. Good. Let's see if that worked for you. Okay, Daryl? Now, make a fist. And I'm going to palm up. Don't lean to the side, though. And now, I'm going to let your arm down just a little bit. And now hold strong. I'm going to try and turn it. Now, I cannot turn that. Daryl can beat me, as you should. Fingers up. The one finger test for the finger extensors. I cannot muscle that down. Good. palm up, make a fist, hold strong. Before I could beat that with no problem, and now I'm not getting it. That's all I got. Fingers up again, hold strong, that's fine. Now we test gluteus medius posterior. I'm going to have you bring your leg way out to test the belly of that muscle. Leg straight, foot's got to be turned out. I'm going to pull this foot toward this foot, but keep that leg straight. Pulling this foot toward this foot, and you try and stop me, hold strong. Nothing's there, not even initial strength. Let's check this side here, foot turned out, hold strong there, and that side he can't hold either. Now, interestingly, the fix for this comes from your feet. The first metatarsal and the first cuneiform, those two bones jam, get fixated. I'm sorry, I went the wrong way. The first metatarsal and first cuneiform get jammed there, and the first cuneiform and navicular get jammed there. When those get jammed, when you step off, your foot locks and your butt spasms because you get stopped in that gait. When this is freed up, you can take a much longer gait because you can push off better. So, the fix for that is a foot slap. Come up, please, Daryl. Sit right here. Bring your foot up, hold right there, and just give it a nice firm slap 2 times. Nice and firm. Bam, bam. So you were aiming kind of out here that you want to get more in the arch.
Okay.
Put your hand up higher up and really smack that thing. Perfect. And now get the other side. One more time. And now lay face up for me again. Retesting the belly of gluteus medius posterior, foot turned out. I'm going to pull this foot toward this foot. You try and stop me. He has his initial strength. I'm going to force it. He's got his core strength and now hold super strong. 1, 2, 3, 4. That's back. Good. Foot turned out. Pulling this foot toward this foot. You hold strong. He has his initial strength. Hold strong. The count of 2. 1, 2. He has his core strength. I'm going to force it. 1, 2, 3, 4. He's got his sustained strength. Awesome. Now we test 2 muscles which are very important. Popliteus, which is behind your knee, and peroneus tertius that comes down the side of your leg, crosses the ankle. When popliteus is weak, it leaves the knee unstable. When peroneus tertius is weak, it leaves the ankle unstable. People are more prone to ankle sprains. So, these tests, for those of you who are studying muscle testing, are hard tests. You have to focus. Even when it is weak, it still feels like it's strong. However, if you can beat it, it's weak. And if you can't beat it, it's strong. You have to power this muscle test. Let your foot turn in. I'm trying to turn your leg, go loose, Daryl. I'm trying to turn your leg, go loose, please. I'm trying to turn your leg like that. I'm going to hold here. I'm going to brace your foot on my forearm, and I'm going to try and turn your foot that way. Hold strong. Try and stop me. Hold strong. He can't hold. There's still some strength there, but you can't beat it. Now for the peroneus tertius test, you hold your little toe out and up. I'm going to hold your heel bone. I'm going to try and power you down and in. Hold strong. I can beat that. Still has some strength, but if I can beat it, it's weak. Same test on this side. Let your leg bend. I'm going to let your foot turn in. I'm going to try and force this foot that way. Hold strong, and I can get it. I can beat that. Hold this foot out and up, out and up. I'm going to pull down, and that one is intact and strong. When this muscle right here, peroneus tertius, is strong, hold up and out, I could pull that and I could drag you to the moon with it. It's not giving in. He's strong on this side, weak on this side. Sit there, please, Daryl. These 2 muscles, popliteus and peroneus tertius, go weak when the knee is fixated. there are two fixes for this. One helps a meniscus fixation. The menisci are two C-shaped cartilages between your femur and your tibia. They get fixated. The fix is take the meaty part under your thumb, find the hinge, push your hands together, give a 1, 2, 3 snap kick, but not too hard. Gentle, actually. Find that hinge joint, and now 1, 2, 3 snap kick. Snap, good. And now do this side. Use this side, yeah, good. And it's 1, 2, 3 snap kick, not too hard. Good. The next fix is for a fixation between the femur and tibia. Take the thumb side of your right hand and wedge it underneath your right knee and go 1, 2, 3, set, gentle. Good. And 1, 2, 3, set. Fine. Now switch hands. Left hand under the left knee, thumb side up, and 1, 2, 3, set. Good. And lay face up, please. First test is going to be for the popliteus muscle. Let your foot turn in, all the way in. I'm going to try and turn it out. Hold strong. It's not going. Good. Hold your little toe up and out. I'm going to push down and in. That is not caving in prior to. You couldn't hold it. And now I'll never beat that. This side was a little weak too. No, this side was strong, but the popliteus was weak on this side. Let your foot turn in, all the way in. And pull this foot that way. You try and stop me. Hold strong. Nice and strong. Excellent.
Being a professional fitness trainer for 20 years, I was most impressed with the difference between what people would emphasize as being weak and strong. I mean, coming in here, I felt I had no weaknesses whatsoever. Unfortunately, I've shown that I have a lot of work to do on whether it be things I need to do functionally in the gym. Obviously, working with your techniques would help, and that's what I got out of this. But hopefully, I'll get a chance to put some more emphasis on applying what I've learned here today. So I really appreciate it. Thank you.
Thank you, Daryl. Daryl learned the quick self fixes and became a member of our Strong Club. Congratulations, Daryl. Start learning how to muscle test, find weak muscles, and make them instantly strong using quick self fixes. This free course includes a 30-minute video and 16-page companion book. This course focuses on 5 major muscles that move and stabilize the shoulder joint. These muscles are commonly found chronically weak in adults on one or both sides of the body. Learn 5 easy muscle tests to quickly assess these muscles and 5 corresponding quick self fixes that make the weak muscles found instantly strong. This is amazing muscle testing fun. Go to quickselffixes.com.